the resident lecture series, Careers in Academics. Our panel today is moderated by Dr. Abhi Mahajan, and he's joined by panelists Dr. Arielle Kurzweil, Dr. Sarah Conway, and Dr. Shraddha Mainali. Thank you all for being here today, and Dr. Mahajan, I'll turn it over to you.
Dr. Conway, Dr. Kurzweil, Dr. Mainali, thank you so much for joining us as panelists on this important session. Well, let's just get into it, and we can take turns answering these questions. So we have a fair breadth of expertise with us in the room today. We have educators, obviously clinicians, but educators, administrators, and researchers, which I think is fantastic for our audience that wants to get more information on how to have excellent careers in academia in neurology. So let's start with Dr. Conway. How did you pick your career track? How did you pick whether you wanted to do a fellowship and what fellowship you wanted to do?
Sure. So going into residency, I tried to keep an open mind, but I thought I would end up in an outpatient-based specialty because I really liked developing longitudinal relationships with patients. So ended up thinking about neuromuscular versus MS neuroimmunology when I decided I wanted to do a fellowship. And then I realized what I liked most about neuromuscular were all the autoimmune conditions like myasthenia. And so then I committed to neuroimmunology. So that was sort of my journey to fellowship.
Fantastic. Dr. Kurzweil?
Sure. So I went into medicine in general thinking I was going to be an internist like my father. And then I went to medical school and caught the neurology bug. And then when I got into residency, I really loved everything about neurology and kind of still had that generalist mindset, that internist mindset, I think, and didn't want to drop anything. So I actually went into my idea of fellowship knowing that I wanted to practice general neurology in some capacity. And similar to Dr. Conway, I thought I really loved those longitudinal relationships and wanted to maintain that through my career. And so I decided on outpatient general neurology. I ultimately chose a fellowship in clinical neurophysiology because now also as program director, I realized that a lot of training in residency is very skewed towards inpatient. And I felt like I needed to hone my skills in more of those outpatient procedures. So reading EEGs, doing EMGs, understanding nerve conductions, and getting my hands wet with that. So ultimately, I decided on a clinical neurophysiology fellowship, understanding that I was going to incorporate that into a general neurology outpatient career.
That is fantastic insight. And we'll tap into that in a second about the discrepancy in how you spend time in residency versus what you might spend time doing once you start practicing. Dr. Mainali.
Really interesting paths, but it's similar to everybody. I think I started neurology with a very open mind. The reason I wanted to do neurology is if I felt like if I wanted to be an expert of something, I want to be an expert of the brain, and that's the broad concept I started my residency with and had a very open mind to what I want to do as a neurologist. In my PGY2 year, I actually absolutely hated stroke and critical care because I didn't know much and I hated the calls. And the more I developed through my training, I realized that my energy and my motivation is really fueled by seeing the impact of my care. So I had the personality where, when I saw a patient in the clinic, I give them a pill and I have no idea what happened for 3 or 6 months or a year until they come back. And that was not as exciting to me. So by PGY3, I knew fairly well that I wanted to do acute care and I wanted to see the impact of my care while I'm delivering it, in front of me. So that's how I ended up doing a stroke fellowship. And then I briefly moved on to a neuroendovascular fellowship, which I decided is not the right choice for me. And then I moved on to neurocritical care fellowship. So I practice stroke and neurocritical care.
Again, this highlights, there's been a lot of conversations over the last few years about the timing of fellowship applications, right? And how our choices are often driven by how we feel during that particular rotation in residency. And that is one part of the picture. The other part is not knowing what an entire life practicing that style of medicine, whether it's outpatient, inpatient, hybrid, etc., what have you. It feels like. So a question that I'm sure you get from your residents as well is that how do you spend your week? What goes on week to week? Because unlike residency, which is up to 80 hours a week, and somebody's decided exactly what you're going to do those 80 hours a week, and sometimes perhaps even after hours, once you're practicing, life can be very complicated. It can be unpredictable. So the question that I have for all our panelists is, how do you spend your week now? Is there, understanding that there may be some variability, but how do you spend your week now, Dr. Conway?
All right. So I do about 8 to 9 weeks inpatient service. So that looks a little bit different because I'm with the residents rounding in the morning on our inpatient wards. But on a given clinic week, I have 2 full days of MS patient clinics. And then the rest of the time I have protected to do medical student teaching, to be involved in our clerkship, and to do things related to our MS fellowship. And then the rest of the time, I have a little bit of buy down to do some clinical research. So it's kind of a mix. I like it because it's a nice mix of things, and each week is a little bit different.
That's a fantastic example again of how complicated a given week or your time can be. You're doing inpatient, outpatient, research, and education, all of it. May I ask you, when you were a resident and you were planning, your career, is this something that you consciously sought out, how you spend your time, or is this something that you picked up? These things are some things that you picked up on as you went forward in your career.
100% picked up along the way. So when I started my career, when I signed my contract, I had more clinical time because I didn't have any, what we call like academic buy down for any of the leadership positions. And so I was doing more clinic probably for the first 2 years, and then slowly over time, as some education leadership positions opened up, I applied and then was able to reduce my clinic over time. But I was really lucky to have mentors that were like, you should apply to these things. Like, it's okay if you don't get it, just apply, get your name out there. So if I had to give some advice, I'd say, even if you think you're underqualified, just apply. And like, I applied to some things I didn't get it my first year. I applied again the second year, and then I was able to kind of get my foot in the door with some of these medical education leadership opportunities.
Fantastic. Dr. Kurzweil.
Yeah, so I think we're probably all master multitaskers on this panel, because I think there's, in academic neurology and medicine, that there are a lot of things that we're interested and passionate about and that we like to pursue. And so I'm certainly one of those people. And as a general neurologist, my week looks different every day because of who I see and what I do. So I see patients Monday through Thursday, not all day, every day. So for instance, today I had my morning reserved for conferences with my residents. I had semi-annual evaluations with my residents, and now I'm doing something like this. And right after this at 1 p.m., I start seeing patients for the afternoon. So some of my days, Monday through Thursday, is mixed, and some of them are all patients. Monday, I see patients with all kinds of neurologic issues, general neurology. Tuesday's my EMG day, so I spend my day in the EMG lab, and I see mostly peripheral neurology, of course. And then Wednesday is all day general neurology patients. And then Thursday I reserve for my procedure days. So I do Botox for chronic migraine, hemifacial spasm. I do skin biopsies for small fiber neuropathy patients. And so I kind of reserve my Thursday afternoons as my kind of quote unquote procedure day beyond EMG. So I'm really varied. Fridays I reserve for, quote, admin time, but those are my residency recruitment days during our recruitment seasons that we're just wrapping up right now. And so I'm interviewing people, I'm meeting with our residents, I'm doing teaching. Like Sarah, I do a lot of teaching with our clerkship students for medical schools. So I do OSCEs with them. So that's mostly my teaching and academic day.
And then when you were a resident, is this how you saw your average week or your work looking like? Or again, is this something that you picked up along the way?
So I always saw myself as more of like a generalist, as I mentioned earlier. And so I always kind of was hoping for this kind of like a little bit of everything kind of career. And so I love it. I love the variability, and I really like being predominantly in the outpatient setting. I should say that I do about 5 to 6 weeks of inpatient time throughout the course of the year, just by way of being in an academic setting. And I do general ward and general consult service, and work really closely with the residents inpatient as well. So I do some inpatient time too, but mostly outpatient. So I think I saw my clinical career being really varied like this, and I'm really happy it worked out this way. I would say I never saw myself as an educator until I started teaching when I was a resident, and I said, oh, I really love this. And really caught the education bug more when I was a resident. And so I've been really lucky to kind of get opportunities and apply to opportunities similar to what Sarah was saying, and leadership opportunities in education and things like that to kind of build my tool set as an educator. But I would say that came a little bit later, and has been a work in progress and evolving.
Yeah, I think it's hard to sometimes, we forget, all of us forget it often, but it's hard to quantify the kind of work satisfaction that you get working with trainees and med students. I think that is that is often underestimated. Dr. Mainali.
So my time, I think the way I divide my time has evolved as I have progressed through my academic career. Like Dr. Kurzweil mentioned, initially I was clinically very heavy as a junior faculty and served in the neurocritical care unit in stroke. I moved to this institution about 4.5 years ago as the director of stroke and neurocritical care research. So I had about 30% protected time to start with. And so my weeks is mostly divided into I do about 1 ICU week a month. So it's a 12-hour shift. And I have about 5 weeks of stroke throughout the year. So about total 17 weeks of clinical time, and a lot of additional time really is focused on research, grant writing, manuscripts. And over the years, just like Dr. Kurzweil said, I thought, I really wanted to get into neurology for research and I want to focus on that. But the more I grow into my career, I really love being an educator and find gratification through education to trainees, to junior faculty, mentoring them. And now as chair of the Neurocritical Care Research Central, and as a chair of the education module for the Curing Coma campaign, which is a global initiative of the Neurocritical Care Society. I love educating multi-professionals, the stakeholders throughout, and I just feel like I've evolved into my role, and I'm continuing to grow and discover myself. So really being nimble, taking opportunities that excite you as they come, being open to doors that open along your career path. I think is how things have been going and going well so far.
No, this is really interesting. As I'm listening to all of our esteemed panelists talk about what they're doing now and what they thought their careers would look like when they were residents, I think it's really interesting that everybody's embraced being nimble and taking up opportunities as they come along, and obviously flourished in them. And so I think it's important for our residents to note that a career in academia is in constant evolution, and you take the opportunities that you get and you make the most of it. And of course, it can be incredibly satisfying. The classical teaching in academic medicine, academic neurology has always been to pick a lane, right? So I think from what I've heard from all our panelists, everybody is doing research, education, clinical work, and to some extent, at least to some extent, sub-administrative work. And the classical teaching in academic medicine has always been, well, pick a lane, excel in it, and that's how you stand out. But what I'm hearing from everybody is that success does not need to look a certain way. You can actually make a fantastic career out of making the most of your opportunities. So I'd like all of you to comment on this aspect. I think at a time when we'll come to that later when we talk about these things in more detail, at a time when there's a lot of news in the media about research funding and so on and so forth, I would love your perspective on this. Dr. Conway, can we start with you, please?
Yeah, so specifically thinking about research funding is the question?
No, so the question is, instead of picking a lane and trying to stick to that lane, rolling with the punches, making the most of opportunities, and then having a successful career. Your perspective on that?
When I was like transitioning between fellowship and attending, I remember one of our senior faculty were like, you need to pick a niche. And I was like, I'm an MS specialist. Like, what am I supposed to do? Like, pick something that no one else is doing. I'm like, well, there's 12 MS clinicians working here and everyone has their niche. Like, how am I supposed to find something else? So it ended up sort of evolving throughout my fellowship. Literally through a fellowship journal club, I picked an article on infectious complications of B-cell therapy for MS. This was like during peak COVID, and that sort of stemmed my research interest in the field. So it was a little bit of coincidence, to be honest. And then I just kind of went with it, and that became my niche. And I'm really, really happy doing that.
Dr. Kurzweil?
Yeah, I would say that, you know, in academia, it's really fun now to be involved in and have hands in a lot of different areas. And so again, kind of from that generalist mentality, I wouldn't want to drop anything. I don't do like basic science or clinical research per se, but I do some education research. And so I think that's an area also that as an educator, you can really kind of tie your interests in nicely to thinking about, are we teaching the best way? Are there better ways to be doing this? And how can we kind of be scientific in our approach in looking at that? And so in that, you're incorporating research into kind of also your career as a clinician educator. So it's actually been really fun for me to do all of that. But to kind of speak a little bit to what Sarah was saying, I do think that it's always good to, once you're getting your hands wet and working on your passions and kind of building those, to think about what are the gaps, right? Like what is out there that you think could be done better, or it could be done that's not being done already, and try to look into that a little bit more, and maybe that becomes that niche of yours, because then I do think that you're a little bit more of like a, so to speak, wanted commodity, right? Like to talk a little bit more about that and to educate people a little more about that in the larger community. And so for me, that's been a little bit of my work in simulation, right? So when I became a program director, I was thinking about how we were assessing residents on their communication skills and professionalism skills. And I didn't feel like there were really great ways to do that, but we had this incredible resource at our disposal, and that was our simulation center. And so thinking about like utilizing that a little bit more became kind of like a little bit of a niche thing that I really loved to do and looked a little bit more into. So that's what I would say.
Fantastic advice. Dr. Mainali?
Yeah, I think I would just agree with both Dr. Conway and Kurzweil in terms of really being open to reinventing yourself and maximizing your potential in the environment that you have, right? Not every environment provides all the infrastructure that is needed for your success. So so being nimble again is the key. Being resilient is the key. Identifying the space that you have in one institution, you might have a growth trajectory that is with strong potential in one area. If you're in a different institution, things might change a little bit. Having said that, I think really being open to rediscovering yourself, reinventing yourself, identifying your strengths, and that, like Dr. Kurzweil said, identifying the gaps that needs to be filled to find a way to help fill that gap. So that becomes your strength, and that becomes something that you get talked about, right? So as a stroke and neurocritical care doctor, I feel like I own all acute brain injury. I'm invested in all of those, and I want to care for all of those. And I don't want to separate a patient with subarachnoid hemorrhage from a patient with acute ischemic stroke. But the bigger thing here is when people ask you to pick a track, it's mostly the goal is, you know, as in your assistant professor, associate professor level, it's totally fine to do everything, and really trying to find what really excites you and interests you. When you move forward to an application to professor level, people want to know if someone wants to wants to find something, they want to know they can come to you for a specific topic or a specific subject, like a leader of a certain thing, right? So as you grow into that career, it's really important to kind of set yourself apart as an expert in something, and that's what niche is really about. Does that expertise have to be only research related, only education related, only clinical related? No, you can excel in all of those in a particular topic. For example, this kind of evolved organically for me. I'm very passionate about caring for acute brain injury patients across the spectrum of disease. But thankfully, all of from intracranial hemorrhage to status epilepticus to traumatic brain injury to stroke, everything culminates into coma and disorders of consciousness, especially in the critically ill patients. And that kind of became my passion. So, my research focuses on acute brain injury in critically ill patients, and my education focuses on coma and disorders of consciousness. And I take care of those patients in the ICU, and it all culminates. So I think at the end of the day, trying to find what is available to you, trying to tap into your interest and your expertise, and building on that is what I would say.
So I guess the key message here is to let expertise, if there has to be one area that you're interested in, passionate about, and known for, let it build organically. Is that the key message here? That's fantastic.
Yeah, let it build organically and really be open. Don't be closed-minded. Look at your space, read your space, look what's available to you, find your interest in your space, and grow from there.
Thank you. I'd like to remind our attendees that you can post questions in the Q&A session, Q&A space. You can post them now, and if they're even tangential to the topics that we're talking about, I can always pose those questions to our panelists. Now, all of you have talked about how opportunities and to some extent mentors at your institution have shaped your career so far. What about mentors at different institutions? How have they helped your career and helped you grow in your current role? Let's mix it up a little bit. Dr. Kurzweil, would you like to go first?
So before I actually talk about mentors at other institutions, the one thing I would also encourage people to do is look beyond your department, look beyond your program, and look within your own institution, but at other people. So just going back to a little bit about what I said earlier, that simulation is something that I ended up learning to really love and utilize as a resource. I was so fortunate and privileged that I had incredible people at NYU who were working within this space, but in different departments of internal medicine and pediatrics. And they were so generous in lending their expertise and some of the scripts even for specific cases. And I was able to utilize those and adapt them for my learners. And I really would encourage people to kind of look beyond the walls of even neurology, even within their own institution, because I think there's so much we could do when we collaborate, and there's just a wealth of knowledge out there. And if you're willing to share, other people are willing to share, and there's a lot to learn from those folks. But to answer your question a little more specifically, I think it's also really valuable to look beyond the walls of your institution. And I think AAN is an example of a great place to do that, right? There are ways that you can network with other folks who are either in your subspecialty, other interests in the research realm. We now have an education room and an education hub at every AAN meeting. And I think it's been really, really helpful to meet people at these meetings. And then those are the people that I see every year in April. And those are now my friends, in other institutions because of those shared interests. And there are lots of ways to maintain those relationships longitudinally throughout the year. And I think some of those happen organically, actually, and they kind of spiral from these meetings, and you start making these kind of Zoom groups. And then some of them are a little bit more formal, like these consortia or synapse and some of these other subcommittees. So I would really encourage people to also kind of look beyond the walls. And I think, AAN is a great example of a program that helps you do that.
Dr. Mainali.
So, mentorship in my mind comes in multiple different ways, right? So there's really no one particular mentor, unless, you have this interest in an esoteric disease. There's a top 2 field leaders, and you're fortunate to be their mentees, and you just focus your career in that field. generally, a lot of people need multiple layers of mentorship. And from that, I really mean it's mostly guidance and support, right? So those two key things. So it could be a research mentor on the topic that you're interested in. That could be in your institution, in your department, outside your department, who has, if you're trying to apply for an NIH research on something about neuroinflammation, and there's a person very, very highly involved in NIH applications with who has expertise in inflammation but doesn't know neurology, you can be the clinical expert, but that person can still be your mentor. You need peer mentorship for from people who are around you and people who are kind of at or a little bit above your level, who are doing great things, and you know them and you want them to sponsor you. You want them to kind of inspire you. That those peer mentorship are important. You want people who are willing to sponsor you. Very importantly, there could be people who have zero idea or interest in what you're doing, but are really invested in your success, and they're willing to put your name through in an important committee, or invite you to write a paper, or kind of, you know, be a person to be your referee for anything that you apply to. And so it really comes in multiple forms. So really don't think mentorship is one single track. Fortunately, you know, professional organizations do provide that background through various mentorship programs, like AAN does that, Neurocritical Care Society. We actually revamped the entire organizational structure for mentorship for research, and we've initiated this research engagement and mentorship program for trainees and junior faculty. I'm sure many other neurological subspecialty organizations do the same thing. So really not being stuck with the idea that I need to find a mentor, but trying to find inspiration, scholarship, and mentorship through people that you identify along the way, and being connected to through professional societies to people in your field who could serve as your mentor, either organically in an invested way, or find that relationship you can reach out to for questions. So I think that'd be my advice.
That is fantastic advice. So, in addition to mentorship, sponsorship as well, and of course, I think one of the questions that I had was working with societies such as such as the AAN, but I think we've covered some solid ground there. Yes, and movement disorders as well. We have something called the MDS LEAP program, which is again a mentor-mentee kind of a program. Dr. Conway.
Yeah, I have a couple thoughts on this. Obviously, getting involved with national organizations and disease-specific organizations can be very helpful. The second is, I know where I work, we've done some multi-center studies, and actually ended up being one of our residents on a paper with a senior author from another institution, and that has been a wonderful way for me to get to know different people and get my name kind of out in the air, right? So collaborative studies. And then the third way that I found mentorship at other places honestly tends to be through people who I knew through residency, or as faculty who've moved and gone on to different institutions, and I've stayed in touch with them, and then they've been able to put me in touch with people at their center. So I kind of look to them. Obviously, we're sad when people move, but like think of it as a potential way to meet other people and boost your career in different ways.
Absolutely. So just as an offshoot of that question, as we're talking about different organizations and societies, etc., in addition to helping you make connections with other people who've been instrumental in your career, to residents listening onto this call, why do you get involved with different organizations such as the AAN and subspecialty organizations? How do you get involved with them, and how can they help your career move forward? Let's start with Dr. Mainali.
All right. So I think, whatever subspecialty you're interested in, I think having the parent body AAN for like a, diverse group of individuals, I think that's a great idea to start with. You can start as early as your residency. There's a lot of training programs within AAN, as well as if you already have a subspecialty picked, you're in your senior years of your residency, then you should probably have AAN as your base, and then one of those subspecialty to start with. Why do you need it? I think all of us in general are shaped by the environment around us, right? We need to be fed and inspired and motivated by seeing things around us. So if we kind of completely detach ourselves, if we finish our residency and completely detach ourselves from our professional organizations and kind of just focus on home and work life, then it's hard to find that inspiration. So the most important reason to join professional organizations is to find like-minded people and a sense of not just finding collaborators, but also finding inspiration, because you're constantly watching people grow and build themselves in those academic fields. So I think that's one of the most important things. The second thing is, like I said, sponsorship. Finding right people to mentor you, sponsor you, and then finding peers that that you like in the field, that you can be friends in the field, and that you can grow together within the field and find inspiration from in the field. So I think those are all the reasons to do it, is to stay connected to your field and understand the opportunities for growth. And these professional societies also provide infrastructure to help you, whether it's career advice, whether it's research pilot funding, whether it's education. So all of those important reasons.
Those are a lot of really good reasons why one should be involved with professional societies, not the least of which is it truly does help fill your cup, especially attending these conferences can be sometimes all you need to get out of the rut and feel inspired and go for the brass ring. Dr. Kurzweil.
So I totally agree with Dr. Mainali. I would say that, making connections, networking, mentorship, that is all super important. And I think probably the number one reason why you would be part of these organizations. But I would also say a big part of it is to build skills. And I think that what I mean by that is build skills as an educator, as a clinician, as a researcher by networking, but also by being part of individual programs. So something like the AAN offers these leadership programs, and the leadership skills are not specific to any one area within academia, but they're applicable and very universal in no matter what you do. And so I think you're building skills as a leader. Another example would be that a lot of these organizations are really big on advocacy, and you can really build your skills as an advocate for your patients at local levels, at state levels, at federal levels. And, you could do that locally within local organizations. A lot of the states have their own neuro societies, but you could do it on a larger level like AAN and other organizations. And they have a lot of ways to build your skills as an advocate. And I didn't even really understand what that meant before I started going to some of the meetings at New York State Neuro Society, at AAN, at some of these meetings where I said, oh, advocacy is like a huge part of neurology that I didn't know existed. And so you can kind of build your skills based on that. I'll stop there.
Dr. Conway.
So I guess to the first point, like how do you get involved? I think obviously I wish I was involved more as a early trainee in some of these organizations, but I didn't have the opportunity. And so now sort of how I've done it is really just by showing up at the meetings. Like if you're interested in education, literally go to the education room, talk to people, meet people, say you're interested in getting involved in leadership, and just make your interest known. And that goes a long way. And then to the second part of the question, I think for me, at least personally, being involved in these more national organizations is the opportunity to hear what others are doing. And there's like this contagious enthusiasm sometimes from being in the room with people that can really like help push projects along.
Great reasons why you should be more involved. All right, I want to delve deeper into, we have some time and I don't see any questions in the Q&A. I want to go deeper into each of these different aspects: education, research, administration, and clinical work as well. But before we do that, one very broad question. If you could go back in time to residency, what is it that you did not do that you wish you had done that would galvanize, incentivize success? Let's start with Dr. Kurzweil.
So I think residency is like an amazing time to have access to experts across tons of fields, right? So usually a lot of programs are set up with experts in MS, experts in ICU, critical care, and stroke, and neuro-ophthalmology, and EMG and neuromuscular. And so I think really capitalizing on that is a good idea while you're in training before you might really narrow your focus a little bit more. And so something I wish I had done was really like utilize my elective time a little bit more wisely and build those skills. So, looking at a fundus has always been difficult for me. I do it on every patient though, so that I can really practice that and know what I'm looking at and know when something really looks abnormal and I have to utilize my neuro-optho colleagues. So it would have been really wise to spend more time in something like that and build those skills. Similarly, I love incorporating procedures into my practice. And I would say that I had to build those skills beyond training. But I think that you can utilize elective time in your training to really do that, or to think creatively about how to talk to your leadership about how do you incorporate those things more within your rotations, right? And build your skills that way. So I probably would have done that.
Dr. Conway?
So I would have done a couple things. One, I would have tried to go to an academic conference during residency. I know that can be hard with scheduling, but I felt like I missed out not being able to go to that. And then the second thing is I feel like, in residency, you're really like just 24/7 in it. And I don't feel like I took time really to take a step back. I was like, okay, I'm doing this rotation, then this rotation. And I wish in retrospect, I could have thought more like, how can I like actually improve my residency experience or, add things to the residency. I've seen now over the past couple of years, residents have so many great ideas that they've brought to program leadership that have led to change. And I just felt like I had this mindset of, okay, I'm going to do X, Y, Z and not really taking a step back.
Yeah, I think it's hard to take to have the perspective, the big picture perspective when you're in the trenches the entire time during residency. So that is a point well made. I will add one point here because this is a suggestion that was made to me in PGY too. I did my residency in Detroit, and it was the same way. We were always in the ER, always answering pages, etc. And I had a profound distaste for stroke and critical care for that reason as well. But the advice that I got from a friend of mine who was 4 or 5 years ahead of me was try and do many things, not just one thing, which at that point I thought was profoundly stupid because I had no time to do anything. But in retrospect, I think that was, and I ended up starting to do that in PGY 3 and 4. I think what ends up happening is if you put all your eggs in one basket and things don't go your way, it's really easy to get disheartened at a time when you're so busy. But if you have 2 or 3 different projects going, even if they're going slower, you can, kind of shift your focus and shift your happiness to the other project. But I always thought that was weird, paradoxically good advice, and I always try and give that advice to my own trainees. Dr. Mainali.
That's good advice, Dr. Mahajan. I think I agree that it's really important to try to really think through each rotation you go through to see how do you like it? Do you truly enjoy it? Because one of the most important things you can do as a resident is to really think through your residency as a stepping stone to your professional career. So, just trying to, have a one-track mind on, I wanted to do this and maybe I should do this, and trying to get into a subspecialty or a specialty that is not exciting to you is not going to be a fulfilling career, and it's easy to burn out. So the most important thing you can do during training years is to really try to understand what are your true interests and not be biased by the preconceived notion that brought you to this residency, right? I saw like my uncle be this greatest movement disorder doctor, and I always thought I wanted to be a movement disorder doctor. But once I did my clinical training, you don't want that preconceived bias. You want to be very open to what you truly like as a human being, not because someone inspired you and you thought that's what you like. Because a lot of us have surrounding influence around us that shape us into the path that we take. But the most important thing is to know that you're in it for yourself, for a long haul, for your career. So in order to prevent burnout, know your own true self and what excites you. So I think that's the most important thing. The second thing is it's very easy to be very overwhelmed during residency and feel like you've accomplished so much just by finishing residency, and you're so focused on passing the boards. But in the bigger scale of things, those are just the basic foundation you set to truly launch into your career. So trying to think through what is it that you want to do in your profession, just have a basic idea of what kind of lifestyle you want, what you want to do. And if it is research, one of the things that I think is helpful is to identify what kind of research early in your training, in your senior residency and your fellowship years, because trying to identify a mentor in the early years is such a huge benefit in research, because a lot of research grants are geared towards early career people. So if you have figured out nothing and you come into a research track and now you're scrambling to find a mentor, by year 3, you've lost your chance to get your KL2, your initial funding. By year 10, you've lost your early career status from NIH criteria description. So particularly for research, it's important to think about what kind and look into who are the field leaders in the topic that I have. Can I go to a professional society to connect to those? From clinical standpoint, really, honing in skills on the things that you truly, truly want to do. Totally okay to be a neurohospitalist and a generalist and want to do everything early on, and then, move on after that based on your interests. It's totally okay not to have anything figured out either. I don't want to scare you to say you have to have it figured out. It's totally okay to keep an open mind. But if you have a very strong interest in something, try to identify field leaders and mentors early that can set you up for earlier success. But it's also okay not to be stressed and say, you know what, I don't know what I want. I will take my time and I want to figure this out as I go. That's okay too.
I think it's important to contrast these two approaches and the many other approaches that happen during residency. I think we talked about how you can pick up opportunities that come along the way and have a fantastic, rewarding career. And also, if you're really interested in something, as Dr. Mainali said, you can just focus on that. I think I've confused myself. I don't remember if I went through all of my panelists on this specific question. Dr. Kurzweil, did we talk to you about this one yet or
Yeah,
not?
we did. But actually, I did have one thing that I just wanted to kind of segue off of what you had said earlier, which is like to get your feet wet in a few different projects at the same time, and then see what you really like and what sticks. And I love that idea, and I think it's great. The only thing I would add to that I would encourage residents to do is try as best as you can to hold yourself accountable. So set a date by which time you're going to be finished with at least a draft of something and send it to your mentor, send it to the supervising faculty member to review. Only because if you have your hand in a lot of different things during training, which is a time where you're building your clinical skills and you're very clinically busy, I think things can get lost in the shuffle. And it's such a shame to start something and not see it to its finish, but it's easy for that to happen. For myself too. I mean, so that's something that I wish I had done a little bit more in training. So I'd encourage others to do too, is just hold yourself accountable, set times, set dates, put reminders in your calendar, email your mentor and say, I'm going to have a draft to you by this date, just so that things actually get pen to paper and you finish things and accomplish things.
A couple of things. I think all of you have certain either educational or administrative roles in your current position. I think I think this is an important topic because a lot of our trainees often get mixed messages about such roles. What kind of administrative roles should you take on, and when should you take them on? I understand this is a very broad question, but let's start with Dr. Mainali again.
I think for me, career choices are a marathon. It's not a sprint, right? So I don't feel the need to rush into one thing after another and doing everything at a time, confusing and not having the time and space to know what I want to be as an individual on the whole. It really depends on you when you feel ready to take a leadership position. And when I say when you feel ready, it's not like when you are skillful enough, but what stage of your career. Taking any kind of administrative role it comes with a lot of management concerns, a lot of complaints, a lot of people management skills that we don't typically develop in our training years, right? That comes with experience, that comes with working with a lot of people. And, if you have a lot of responsibility at your home, family, kids, is that the right time you want to take that responsibility? I think it's a very individual decision. You do want to stay on track to growing into a leadership role. Like Dr. Kurzweil said earlier, getting through those leadership programs, I think, was critically helpful for me in shaping. It's not that it changed who I am, but it helped me I think one of the most important things leadership programs do is help you in self-advocacy, which we naturally, a lot of, especially women, are very poor at, right? Where the hardest workers do a lot of things, but it's hard for us to put ourselves forth. And leadership programs help shape that, both for men and women and everybody else. So it's really important to take some leadership, training if you have the opportunity to do so. Thankfully, AN provides those, and understand when you're ready for leadership roles. Know your personal space, know your family space, know what's right for you, and there's no right time. The time is when it feels right to you.
Is there, just following up on that question, do you ever actually, when you're starting out for a true leadership role, do you ever feel ready, or do you just take a leap of faith?
Yeah, I think that's a really good question. To that, I would say, don't wait until you feel 100% ready. That's not what I meant when I said when you feel 100% ready from skill standpoint. I think leadership comes to you. It's a learning process and it's a growing process. I meant when you're ready to handle the responsibility that comes with the role. So I don't think you're going to be 100% feeling, I feel like now I'm a leader today, and then go for a role, because it's not going to come. Like, opportunities doesn't stick. There's an opening, people are thinking about you, it comes, and if it's the right position for you, then that's the right role for you if that's the right time. So don't be afraid to say no to opportunities if it's the right thing for you at that phase of your life. Because profession is just one part of your life. When I say, when it's right for you, evaluate your life as a whole. If you have two young toddlers at home and you're, have two full-time working, a full-time working spouse, and you're struggling to make your ends meet, then trying to take a big leadership role is probably not helpful. It's easy for you to burn out. But don't feel like anyone's ever going to feel 100% ready for anything. It's okay to be open to opportunities and learn. And the most important thing, someone else mentioned accountability. Most important thing that people look for is a sense of responsibility, sense of accountability. People should be able to depend on you to deliver, right? And resilience, be able to bounce back up when you fail. And having an ethical and moral compass, so you are grounded in your values. So I think those are the most important thing, and you'll know when you're ready. But don't afraid to jump in when you don't feel prepared, because no one is fully prepared ever.
Thank you. We have a couple of questions here, so I'm going to just go back to our panelists and let them answer the previous question a little bit quicker, please, if you don't mind. Dr. Conway.
So someone once gave me the advice, if you're evaluating an opportunity, to think about three things. One, will it make you happy? Two, will it further your career? And three, is it doable, right? Is it going to be like some small thing that sure you can just do? And if it's two out of the three, you should strongly consider that. I think obviously it's not a perfect formula, but a way to approach these opportunities. And then the second thing I'll just quickly ask for is clarify if the admin position will have funding or academic buy down. And if not, think very carefully about it or advocate for such.
Fantastic. Dr. Kurzweil?
I don't have much more to add, except that we do administrative stuff all the time without funding, without any kind of price tag. We do it just because it's like we roll with it, and it is the opportunity that came up, and it kind of goes along oftentimes with other things that we really love to do. And so although I really like the advice of the other panelists, I think oftentimes you have to just seize the opportunity if it might grow into something else. So it might not be something you love to do. It might not have good payback. But I do think that especially early on, I know a lot of people say no. I say just say yes. And I'm a big proponent of when you're early, I would really, really consider before turning down opportunities about what doors that might open, to be honest.
We have a question here. What is your recommendation for splitting time in clinical research and education? I think that question is going to be with us for centuries in the future as well. But I'm going to start with Dr. Conway.
I think it's hard to do anything exactly equal, right? So, and there's going to be shifts. So 1 year may look different than the next. And I think some of it is just going to be what are the opportunities in that moment. There are like next level ways you can, if you're interested in research, you can do education research, right? So you can kind of combine both opportunities.
Dr. Mainali?
I agree with Dr. Conway. It's what works for you and totally okay to combine. Education and research can be combined easily. So focus on what works for you and what you want to do. That's the most important thing.
Dr. Kurzweil?
Yes, I would say all of that and also see what the opportunity is in front of you, right? You can evolve. So although you might take a position that has a certain split of 40, 60, 30, 70, that is not set in stone. Really, nothing is set in stone. Things evolve. And if you do your job well and you do it with enthusiasm and passion, you have a lot more negotiating power. So I say go for it.
I just saw a question on the chat where someone's just asking about how to connect to an inspiring figure in your field. Look up their publication, find their email, and just email them. And one of the most important things is to realize, most of us get hundreds of emails a week. Sometimes we're so busy, we don't get through all emails. We just focus on very important emails. So if someone doesn't reply back, it's not personal. Try to send an email 2 weeks later, and if 2 weeks later fails, wait another 2 weeks to send another email. Don't be pushy and send every 24 hours because that tends to irritate people. Hold your space, send an email. People generally, academics want to help people. We want to help you. We want to promote you. We're just overstretched. Give us time, be persistent, and people will respond.
And I would also include in your email, is there anyone in particular you think I should connect with if you're not available? And oftentimes that might be someone like a coordinator, someone in a research coordination position, or someone who might have more time that could actually set you up with a meeting to give you opportunities. So you might also give someone a possibility of connecting you with someone else.
Great advice. All right. Well, thank you, everybody. Thanks again.
Recording of today's webinar will be available on the AAN's YouTube channel, and you can always visit the AAN's Resident and Fellow Research page for additional offerings that are coming up and to watch past lectures. So thank you again, Dr. Mahajan, Dr. Kurzweil, Dr. Conway, Dr. Mainali, for taking the time to share your experiences and your advice today on pursuing a career in academics. We really appreciate it. And thank you to everyone for joining us. We hope to see you at the next one.